name's Jody Janicki, and I've been in this business. I was one of the first people in Ohio when it first became licensed. My number is 72. So what's that tell you? And I was at the D1 level. I started out at the University of Cincinnati, went to Temple University to get my master's in sports medicine, came home to work at Xavier for 30 years, was a head athletic trainer at Xavier. Then I worked one summer at the WNBA with Chicago Sky. And now I've transferred my skills over into the occupational industrial medicine side, working for a gentleman, Matt Smith, who owns a company called ATS, Athletic Training Solutions. My side works out of urgent cares, and we apply our skill set and do what we've always done, rehab a patient. And there are definite restraints and guidelines that are different than working in the college setting where you kind of do your own thing. You could see a patient 3 times a day or see them 7 days a week to get them back. In order for us to get paid, it's 2 to 3 times a week for an hour block. And you have to document. So it is a bit different. I can tell you that it's been very satisfying working with this new set at the end of my career and applying my skills, but having new and refreshed energy after working college, which can burn you out. The family life balance on this side of the business is far better. And you can get paid. In fact, more than I did at Xavier, probably for most of my career there, if you're in the right setting, making the right money. On my side, I get a base salary, and then Matt takes $1,000, and then we split after that. So it makes it lucrative to work very hard to make the money where you're in a set salary on the college level and your schedule changed and you have no control. I have control over my schedule. We don't work evenings. We don't work weekends. So that might be lucrative to the family person who wants to do family early. How do you get ready to do this job? You get as many skills in rehab that you can. I've used kinesiotaping, I've used Grastons, and I'm certified in both. I made a special splint for someone the other day, but that crosses over in Ohio to the hand clinic people. So you have to be careful. Billing, it's kind of one of those things you do for a patient to adjust something so they can work, but it's not so much that you're billing for. So there are rules of engagement and knowing coding and being exact with matching up coding and knowing the companies that our company is. I have a biller and I have to get her my paperwork. So I have to be very, by the end of the week, or by that day. I can't just let things sit. And I know in college, sometimes you get behind till you're at the end of the season catching things up. We can't do that in our side to bill. You have a limited time restraint. So you get very good at being on time and making sure you look into why things are getting paid or not getting paid. There's rules of engagement in Ohio, for instance, with MCO and their state funded companies versus TPAs, which are very difficult to deal with. They're there to save the big companies money by saying, we will keep your costs down. So it's a fight. And it's one of those, email fights, phone fights, that kind of thing. So you have to have a stomach for that a little bit to get paid, to get your billing through. So our biller just kind of posts, but she doesn't do the fight for us. We have to do that. And lots of communication. But you have to also be willing, and I think when we go into college, we are really ecstatic about knees, shoulders, post-ops. We do some post-ops with doctors that trusted us and trained us for years. What has been the most frustrating? Not getting a patient to buy in. I found my patients, as I tell them in the beginning, I'm only as good as you do your homework. So they're not going to come into me 3 times a day, 7 days a week, and have me kind of work with them. I have to do a lot of skill set training where I give them things to take home and to do. And I have to keep checking with them. Are you doing this at home? How's this working? We have to do restrictions for work so that they can be paid at a higher rate, but that it doesn't injure them any further. So you have to really understand. And if you're not sure what someone does, you ask a lot of questions when they come in to see how we can get around with the employer to keep them at the job site, because those go against employers' BWC insurance rates for the next year. Also, they'd also like to keep them at work. So at that point, you have to be creative. You have to learn what people do for a living. You have to adapt. It's kind of fun on our end. It's new. It's applicable sports medicine. So it is for the active individual. That's what athletic trainers do. You need to have those higher end skills. So this may not be the job for you right away, or you may grow into this one on our side. Now, on the other side, that Matt works with, like Turner Construction Sites. They train you, you get OSHA certified. You can use a lot of your skills right away, and you're on site in a trailer providing these things or getting someone to the urgent care to be x-rayed or seen right away. So there are crossovers in this, and there are people that are hired exactly into that job site to work for that company. And if you look, and if you're smart, you'll start to do your homework. These jobs don't usually work evenings or weekends, and they're very forgiving for scheduling and for families and for the ability to balance your life skills with your work. So those, I can tell you, you might make 60,000 the first year out on the industrial side. And I have made up toward that, where at Xavier, it took me some years to make that. So, which is a shame, but, and worked a lot more hours under a lot more stress, because there are a lot more rules of engagement on our side. You are also protected in that. So that may be something that you want out of this, and how to use your skills. There will be a growth factor. You will do more back work. If you hate back works, we do a lot of neck, T-spine, L-spine, let alone the joints themselves. So you will get better. You will do the research. You will do the CEUs. You will exchange with your peers on these areas to get better, and work with doctors that will grow you.